welcome. You're watching Medically Speaking on NewsX. It's a very special edition. We'll be talking about a very pertinent issue, an issue which many of you may have heard about, may know some basics about, but unfortunately, there isn't enough information about the same. I am talking about breast cancer. Why about breast cancer? Because it's Breast Cancer Awareness Month. Breast cancer is something which afflicts thousands of women, especially when we speak of India. But why is it, despite of multiple efforts by the government when it comes to raising awareness, we have not been able to keep it under check? The numbers are reducing, but what more can we do when it comes to early diagnosis, which really is the key? To explain all of this in much better detail, I'm being joined by a panel of experts, starting first of all with Dr. Meenu Walia. She's the Director of Medical Oncology at the Max Hospital. Dr. V. Sinu is also with us. He's the Professor of Surgery Department at AIMS. Dr. Lavleena Nadir is also with us. She's a Senior Consultant Gynecologist at Rosewalk and Apollo Hospital. And Dr. Ramesh Sareen, Senior Consultant Surgical Oncology at the Indraprastha Apollo Hospital, also with us. I welcome all of you on this extremely special panel. Dr. Sareen has also joined us. So let's open it up for a discussion without much ado, starting first with you, Dr. Meenu Walia. I started this discussion, the introduction spoke about basic awareness around breast cancer. There has been a decent amount of awareness campaigns by the government where we know we need to self-examine, etc. In spite of that, why is there so little information? Help us understand what are the early signs which one needs to look out for. How can one examine themselves? When is it that one needs to raise an alarm? Dr. Meenu Walia.
I'm glad, Meenakshi. First of all, thanks NewsX for the opportunity. And I'm glad, Meenakshi, you asked this question, because this is something, as you said, a very, very pertinent subject. And for the viewers only, if they might want to be interested in knowing, breast cancer in today's day is #1 cancer all over the world. So 2020, it became what I really want to say. I'm not speaking about #1 cancer among the women all over the world. It is the #1 cancer, both men and women put together. So every 19 seconds, a new patient is being diagnosed with breast cancer somewhere in the world. And in our country, the figures are somewhere around every 4 minutes, a new case is diagnosed with breast cancer. Yes, you are very right when you say that in spite of so much of hue and cry, we are still far from the level of enough awareness that we need to create. Maybe the mindset of the people as well as so many other stakeholders might be one of the reasons. Because one is that like most of the people, I feel, we are not very keen on listening or knowing about diseases. We don't want to talk about diseases as if it's a taboo kind of a thing. And especially disease like cancer, there is a social stigma. So even talking about this is something that we don't want to talk about it. And even when a lady has some signs and symptoms, sometimes it is because of the social stigma, because of the lack of awareness, because of shyness, there are not many people will come forward. So coming to your third point, what you wanted to know is what these ladies should be aware of.
Yeah.
What are the signs and symptoms of breast cancer? So majority of the breast cancers will present with a lump in the breast. So lump is the most common symptom that many ladies present with. But again, there is a catch here. Another important point that everybody should know that, yes, although lump is the most common symptom that a lady presents with breast cancer, but that does not mean that all lumps in the breast are cancerous. So there is a significant number of lumps which may not be cancer also, but any lump you have in the breast, but it's like it is very difficult for you to assert it. One should always go to the physician, to your healthcare provider. Apart from that, sometimes it may not be the lump, it may be other changes in the breast, something like change in the size or shape of the breast, or change in the skin of the breast, changes in the nipple, a recent inversion of the nipple and nipple erosion or nipple discharges, some discharge from the nipple, something which is, especially if it is unilateral, that means it is only on one side, or it is bloody, or it is whitish serous in color. So apart from the, not only a lump, apart from that, the changes in the skin, in the size, in the shape, in the nipple changes, these are all the different ways. And in advanced cases, it may also present with breast pain, with pain in the breast. Although initially most lumps
Yeah.
are painless to begin with.
So-
So these are the common symptoms that all ladies need
Right.
to be aware.
Ma'am, you very elaborately explained all the symptoms, and lump can be benign, as you rightly said. But Dr. Seenu, sir, if you could come in here, since you are an expert when we speak of surgeries as well, sir. I think Dr. Valia made a very important point. While early diagnosis is very important, many people are scared. There is a stigma, correct? But there's also a fear, because the word cancer brings doom and gloom to our mind. But end of the day, as a senior surgeon yourself, what would you like to tell the people? Because breast cancer, I'm sure you've seen many, many patients. They can go back to living a very normal life. Obviously, early diagnosis helps as well. How it helps, we'll discuss later, sir. But a word of encouragement and inspiration to the viewers. What would you like to say, Dr. Seenu?
Yeah. The first and most important thing is, as Dr. Meenu has already covered very elaborately as to how the breast cancer presents. Once a diagnosis is made, the first thing we have to tell the patients is that there is nothing to worry. Because in this day and age, currently, very good treatment is available for breast cancer. But the important thing is you have to pick these cancers in a very early stage. If you pick them in an early stage, the survival rates are more than 90% even at 10 years. So what is most important to tell our patients is that we have to pick the breast cancer at an early stage. And there is nothing to worry even if a breast cancer is diagnosed, because in early stage, all the treatments are available, and all the treatments are available in India at most centers, including government and private sector. And there's nothing to worry even if it is diagnosed, because treatment is available. For example, in surgery, you don't have to remove the whole breast, and in the armpit, you don't have to remove all the lymph nodes. Similarly, now such good chemotherapy is available which you can target it, and even in radiotherapy also such good radiotherapy machines are available that you can shorten the radiotherapy, reduce the side effects of radiotherapy. So most important is, even if a breast cancer is diagnosed, there's nothing for the women to worry, because all the treatments are available, and the treatment outcomes are currently, you can say, for all the cancers when you compare. For the breast cancer, the outcomes are excellent.
Well, rightly said, sir. And Dr. Sareen, if you could come in here, since we are speaking about, the type of surgeries available, end of the day, I think everyone's focusing and emphasizing on early diagnosis. And that's why we have public awareness programs also like this. How does early diagnosis help? First of all, help us understand that.
Yeah, right. The early diagnosis, as everybody has said, increases your survival chances. And as we said, in stage 1 and stage 2, there are 4 stages of breast cancer. 1 and 2, your chances of surviving long term, 20-25 years, is up to the tune of 92-93%, as Dr. Seenu has said.
Dr. Nadir, 3 panelists have already spoken and emphasized on early diagnosis. The diagnosis starts with the first contact. Nobody goes to an oncologist first. They come to their gynecologist, they go to their physician. Tell us and help us understand, is there still, say, stigma, hesitation around your patients? Do you tell your patients to regularly start checking themselves after they reach a certain age? Give us more details on that front.
Absolutely. So whenever the patient comes these days, the deaths from breast cancer have definitely come down. And that is because of the breast awareness, breast cancer awareness. We teach people definitely to do a self-breast examination when they come to us for annual checkups, and even otherwise for a gynae checkup, we always examine their breasts. It's a part of the general examination. Teach them how to do a self-breast examination, look for any lump in the breast, look for any changes in the size or shape of the breast, any inversion of the nipple or skin changes. And then we also tell them to get a routine routine mammography done after 40 years of age every year. And we educate them for the importance of mammography, because what it does, the screening, what it does is it helps in the early detection and the successful treatment, because the early detection will ensure that we treat the cancer before it has grown and spread and metastasized. And the type of surgery also depends if the cancer is early detected.
Yeah.
So the successful treatment depends on detection. So we advise a regular mammogram, which should be done every year. And of course, we educate them about the risk factors. If they have a history of any breast lump, if they have a history of breast cancer, if they have a family history of breast cancer, if they are at high risk, we educate them about the high risk factors, like whether they've had some genetic history of whether they're carriers of hereditary genes like BRCA1, BRCA2. We do regular ultrasounds even to look at the ovarian status, because there is definitely some connection between the breast cancer and ovarian cancer. So this is how we routinely educate them. And the most, important thing is that mammography is essential, because sometimes what other diagnostic modalities cannot pick up can be picked up by mammogram, especially the calcification, which can be missed on other modalities. So mammography and ultrasound of the breast is advised by us.
Okay, you say mammogram and ultrasound are advised by you, but Dr. Meenu Walia, help us understand who should go for mammograms. There are certain ages, 30 to 40, what should they do? 40 to 50, if you could explain us that. And secondly, a related question, as Dr. Nader said, that those with genetic history, genetic predisposition, apologies, need to look and screen themselves for cancer. But what about others?
So again, a very, very important question. I think a lot of take home for the audience today. So when we talk about others means everybody with a normal risk, the general population. So the general population needs to do breast screening. So the three components of breast screening are age 20 and above, a monthly breast self-examination. So every lady needs to examine her breast herself. So how to do it? There's enough information that can be learned, but monthly breast self-examination goes a very, very long way. Age 30 and above, we say a clinical breast examination. And this clinical breast examination should be from your healthcare provider, your physician or your gynecologist or whosoever you are seeing. Age 40 and above, we say mammography. Mammography, which is a simple X-ray of the breast, that needs to be done every 1 to 2 years. And these are what we say the breast screening guidelines, the screening that is to pick up the cancer even before it produces signs and symptoms. Even before you feel the lump, you can pick up the cancer early. And these are the screening guidelines that every lady needs to follow. Then your second part of your question was if it is a high risk individual or a lady who is known to have a BRCA mutation or somebody from in the family where BRCA mutation is there. So we say these are high risk. So their risk of having breast cancer is much more higher than a normal lady. For these women, again, the normal screening guidelines do apply. And what is advocated is that we generally begin a bit earlier. So we generally begin at the age of 35 onwards. And in these cases, if the risk is very high, especially if it is a BRCA mutated lady, then instead of mammo, we generally prefer a MRI of the breast also. Why? Because the MRI will have much more sensitivity than a mammography. So this is what needs to be done.
All right. And once, unfortunately, Dr. Seenu, if it is detected, then what happens? Help us understand the procedure. When does one need to get a surgery? And I ask you this specifically because there are a lot of myths also around breast cancer. I've heard it from so many people. They say, if you're diagnosed with breast cancers, the next thing which is going to happen is that you're going to get your breast removed. You have to get it reconstructed, which is clearly, as you mentioned, is not the case.
Yeah. See, once a diagnosis of breast cancer has been made, the next important thing is, which Dr. Sarin was talking about, stages. So you want to know what is the stage of the disease. Okay, so that is the most important thing. So if it is an early stage, when we find out on examination, a tumor which is small in size, there is no gland which is enlarged in the armpit. This is called as an early stage. Here you do not have to do any staging investigations. Whereas if the cancer is little advanced, as Dr. Minu was telling, if there is skin changes or skin ulceration occurs, in that you do a staging investigations like either a CT scan, chest, abdomen, pelvis, or a PET scan to see where it has gone. So that is the first step after a diagnosis. So once you say it is stage 1 and 2, then treatment, the treatment for breast cancer is multimodal treatment. That is the most important thing. It's a team approach, and breast cancer has treatment of surgery, radiotherapy, chemotherapy, hormonal therapy, and targeted therapy. Surgery is the definitive treatment for the tumor which is there in the breast and also for the armpit. And if you have done a surgery where the breast, only small amount of breast is removed, then radiotherapy is must. Whereas based on the reports of this, the patient will further be decided whether they will get something by oral tablets or by injections, which is called as chemotherapy. That will be on the final histopathology report. So this is how the breast cancer is managed. Surgery is the definitive therapy for primary in the breast, that is tumor in the breast, and also to take care of the armpit. Radiotherapy usually is used an adjuvant for if you have done a breast conservation surgery. And if you have a doubt that the tumor has spread elsewhere, suppose the tumor is more than 2 centimeters, or one lymph gland is involved, or there is some types of cancers, such as we do something called as a receptor study. If they are negative, then patients will get chemotherapy. If they are positive and a woman is more than 60, then only hormonal therapy. So this is it. But the most important thing to remember is treatment of breast cancer is multimodal. Only surgery will not be enough. And at the same time, only radiotherapy or chemotherapy is not enough. The treatment is complete only when patient receives all these treatments. And it will again depending on the stage.
So multimodal treatment is what the doctors, of course, go for. But Dr. Sareen, if you could come in here, what happens post-recovery? What is the sort of rehabilitation which you would suggest for your patients? Do they still need to continue visiting oncologists like yourself? Do they still need to examine, go to even gynecologists like Dr. Nadir? What happens post-recovery, ma'am?
Yeah, right. So before the post-recovery, I also want to insist that a complete treatment, when we talk of a long survival, 90 to 93%, the complete treatment must be undertaken by the patient. And one can always make choices about the drugs and all that. And it may not be very expensive. Secondly, post-treatment is a must. One, of course, to look for changes locally in the breast and in the lymph nodes if the cancer comes back. To me, there is still a 2 to 3% chance of a cancer coming back in the local tissues, because sometimes the skin flaps do have a little bit of breast tissue. And if you do a breast conservative surgery, the chances of local recurrence is 5 to 7%, but it's not statistically significant. So that's why we do advocate breast conservation for small tumors. So follow up for a local regional recurrence and follow up for distant recurrence. Recurrences can happen in the bones, in the livers, in the lungs. So we do have 30% patients who can come back with a metastasis, and the follow-up investigations are needed and their follow-up is necessary. Secondly, just to be very quick, there are side effects of the surgery, and the most important side effects is a swelling of the arm. You must have heard of a lymphedema. Swelling of the arm is does not bother with your survival, but it's discomfort and it's a lifelong kind of a thing. So advice regarding the lymphedema prevention, you prevent it even before it happens. And if it does happen, there are methods to treat it so that the lady is comfortable. And then obviously sometimes, you have long-term hormonal therapy has side effects of memory loss, has bony pains, arthritic pain, muscular pain. So all those things needed to be, all those issues needed to be sorted out when patient comes for a follow-up.
Correct.
The hormonal treatment, there are 3 or 4 kinds of drugs.
Yeah.
And if one drug is giving them a very uncomfortable life, obviously you want them to have a comfortable life. You want to forget about their tumor so that they can lead a normal life, and you can always change the hormonal treatment. So an early detection of loco-regional recurrences, distant recurrences, does go a long way in getting their in getting their life online and getting them a longer survival.
Okay, so follow-up is very, very important. While we are speaking of an early diagnosis, the first time if someone does unfortunately notice a lump on their breast, also post their recovery, follow-up of recurrence also, and earlier the diagnosis, the better the chances of treatment and survival. Dr. Nadir, since we are speaking of the first contact, and again I come back to you on that point, there's a lot of hesitation amongst people, stigma. What will you say, especially, because it's about breast, something which many aren't comfortable talking about?
So we just have to tell people that they have to speak up. They shouldn't feel any stigma about it, because it is about saving lives.
Yeah.
And we have to educate them and tell them about decreasing their risk factors. We have to teach them to lead an active, healthy lifestyle, exercise regularly, because physical inactivity is definitely associated with increased risk of breast cancer. We must give them dietary advice, like cutting back on smoking, cutting back on alcohol, eating more fruits and vegetables, and decreasing the processed foods. And of course, be careful about their lifestyle choices. And of course, not hesitate if there is a family history, and they should talk to their doctor or health provider if there is anything, if there's any family history. And women should be more, they should come forward and talk about it with the doctor. And of course, we are there at the helm, and as it has been said, it's a multimodal approach. So all the doctors, all the health providers have to make a conscious effort to talk about and create awareness about breast cancer.
All right. It's been a very riveting discussion. I'm left with about 2 to 3 minutes, and I'll take quick closing comments from all of you. Dr. Meenu Walia, quickly, any word you'd like to say as we close the show?
The only message I want to say is, as all the panelists have already said, there are a lot of improvements in the treatment of breast cancer with multimodality treatment. The things are improving, the survival is improving. There's a lot of hope for cancer patients. But again, at the end of the day, prevention is always the best cure. So if we can prevent it, if we can be aware of it, if we can detect it early, nothing like it. So all the ladies, need to be aware. They need to be aware, and they need to love themselves to really take care of themselves.
Dr. Seenu, would you like to say anything, any message perhaps even for policymakers? I know that, we all know Ayushman Bharat covers about 5 lakh rupees, when it comes to such treatments. But, there's no point of having a discussion, all of us sitting in an ivory tower talking about these big treatments. End of the day, they cost a lot of money, and getting a treatment in AIMS, not very easy. Any changes you'd like to say far as policymakers, government is concerned?
Yeah, first message for patients. My earnest request to everybody is, if a woman who is above the age of 30, if she has a lump in the breast which is painless, please visit your doctor at the earliest, because that is the stage at which if you pick it up, then the results are going to be excellent and your breast need not be removed completely. That is for the patient. And as for the policymakers, as you have rightly said, that the treatment is not the end of it. That's what Dr. Meenu was telling.
Yeah.
Like, you have to either prevent it or then pick it up early. Then how the policymakers can do it is by spreading more awareness about the breast cancer. Second is to teach breast self-examination to the patients through either the Anganwadi workers or the female health guides who are currently available at wellness centers. So breast self-examination should be emphasized, because in India, it is not possible to do mammogram for all the women, because our population is such that it is not possible. But we can pick all these cancers at an early stage, and that can be done by a breast self-examination, and it should be taught to all women, and in fact, even in school, right from school,
so,
we should.
Point taken, early examination, your suggestion. Dr. Serene, if you could quickly come in here, any word of advice for those who have perhaps been detected with breast cancer or have been treated?
Hello. Is that me?
Yes, Dr. Sareen, the question.
Yeah. All right. I think one aspect which hasn't been covered, I'll quickly say it, and that's counseling. Counseling of
Correct.
the patient and counseling of the caregivers is very, very important. Counsel them that it can be cured, it's curable if they take the treatment properly.
Okay.
And also, I think Ayushman Bharat can come in the way that if there is a financial crunch, then maybe, some money can be obtained from there and the
All right.
patients can be helped with us.
From that front as well. All right, that's your point.
Counseling them to take the complete treatment,
Correct.
counseling them to come for a follow-up, counseling them that it is curable. You can lead a normal life. Counseling of the caregivers is even
Correct.
more important. They are
Very
at more
important,
stress.
yes.
When the patient doesn't eat, you get so upset about it. So, counseling with the doctors, counseling from the counselors, and counseling from the survivors of breast cancer patients is very important.
All right, Dr. Nadir, last word. I have about 30 seconds remaining. That's all. If there's anything you'd like to add to all of this.
Yeah, women have to love themselves. They have to be more aware. And I urge every woman to go for a regular health checkup. That is very, very important. They must visit a gynecologist and they must do a regular health checkup. And that helps in early detection and saving lives.
All right. As far as the panel is concerned, early detection, early diagnosis really is the key. And of course, unfortunately, even if you are detected with breast cancer, it's not the end of the world. As all the expert doctors, panels, surgeons, oncologists, gynecologists have told us, there is a life beyond cancer. You can get fully cured. Have faith. But end of the day, keep checking yourself. On that note, I'd like to thank all of you experts for joining us on this program. Thank you for taking our time to speak to us on NewsX.
For more such videos, subscribe to the NewsX YouTube channel, hit the bell icon.